colic is a very broad one, and it's kind of hard to talk about it, I think, but I just want to remind everyone that colic is just abdominal pain. It is a symptom. It's not a disease. So but we talk about it like it is a disease, but oftentimes there are many things that can cause this abdominal pain. And sometimes it is GI disease. And I'm going to reiterate several times that horses are not cows. And I know most veterinarians in India are more familiar with cows, much more than I am, to be honest. But we got to remember that horses are herbivores, and they're made to eat forage all the time, similar to cows. But their GI system is very different. They only have one stomach that is very small and only can contain about 3 to 5 gallons. They cannot vomit. They don't ruminate. There's a very sharp angle where the esophagus meets the stomach, and there's a very strong esophageal sphincter, so they cannot vomit. They use their small intestine to digest starches and proteins and fat. But they have this huge hindgut, and the cecum is like a fermenting vat where they digest fibers. And they have a large colon, very complex. They have a right ventral colon, left ventral colon, then it kind of twists up and it forms the left dorsal colon, and then right dorsal colon, and then it goes to the transverse colon into the small colon and the rectum. So it's very tortuous, and it can get itself into big trouble. That's why horses are prone to colic. Some people may say that the GI system of a horse is not well designed, but I guess it's so we can be challenged as veterinarians how to treat it. But I think God makes everything perfect. So but anyways, it does have its design does set itself up to have issues. But there are many non-GI diseases that can also cause abdominal pain. So we have to keep that in open mind. This picture here is just on the left side of a horse, showing the abdominal contents of a horse. So again, I just want to say that horses are not cows. And when I talked to Dr. Dixon and Dr. Benjamin before, kind of as a lead in to try to give information that's pertinent for you, thought that was really important to reiterate. So I just listed here a few brief things that kind of you have to remember is that when we pass a tube in a horse, we do a nasogastric tube intubation, where in a cow you do oral gastric. Horses are very sensitive to infection. You cannot do the surgeries in a horse in a backyard situation out in the field the way you can in cows. You got to remember that there are only one stomach, a very simple stomach in a horse, and well, there are multiple in cows. Their temperament is very different. Horses can be very difficult to work on in certain circumstances. They're somewhat fractious and spooky, where cows are, I would say, very quiet in most circumstances, but they can kick pretty well, that's for sure. And horses require much more maintenance to keep alive, and they're expensive. And I think that this is why in India, probably as far as cart animals, I mean, horses cost a lot to keep. You have to keep their feet trimmed. You have to probably put shoes on them. So it's very expensive. And horses need very much cleaner feed. So those things I think are very important to keep in mind when you talk about the same thing we can do to a cow, we cannot do to a horse. So I guess what does colic look like in a horse? It can look and if you look at these pictures, they kind of from severity go less severe at the top to more severe down the bottom. And it could be that it's just my horse hasn't eaten for a meal. It may be that the horse is just not acting right. It could be that the horse is kind of sitting on the back wall in the stall. It could be that the horse is laying down more than normal. It could be that it's got the phlegm response, basically turning its nose up or even yawning. It could be that it's kind of just stretched out like that top left-hand corner, the left-hand picture, just stretching out, just not with its head down, just not feeling well, kind of like in the same position when a horse would urinate. It could be like the top right, just looking at the flank, like something's bothering me, but I don't know quite what. It may be that they're pawing with its front feet or kicking at its belly. But when they get very uncomfortable, they start to roll. It's just like us kind of curling up in a ball. They're trying to get away from pain in their abdomen, and they just don't know exactly how. So it's just, there's a whole spectrum of what colic is. But again, remembering that colic is basically just abdominal pain and how the animal acts in regards to it. So, but colic that's in an adult horse, but in a foal could be very different. They oftentimes just roll up. This foal at the bottom is just rolling up on its back. They may be just going to nurse and just playing with the udder of the mare. But foals are very prone to gastric ulcers, and they can rupture. And oftentimes in a very young foal, they can have the first feces that are within the rectum of a foal, they can have impactions. And even in the birthing process, especially in stallions or males, the bladder can rupture, and so they can show abdominal pain. So this is just kind of a summary. I just kind of wanted you like, how do you make a diagnosis that it's colic or not? You basically, you want to know history. What's the horse doing? What are the people that own the horse doing? Or what are the farmers noticing about their animal? On physical examination, you do a complete physical, and I'll go in detail what I do that, but a good physical examination. For us, we always perform rectal examinations to kind of find out what things feel like in the abdomen of a horse, because you can feel quite a bit in a horse. If you had that luxury of having an ultrasound machine, which here in the States we do, but I realize in rural areas you wouldn't, but maybe if you were doing as an ultrasound machine, that can tell you a lot. Also, it can be that if a horse is really, really uncomfortable, you may even do a peritoneal tap and get peritoneal fluid and see if there's some sort of rupture or something going on. You may do blood tests. But many times what we do is we treat the horse, which I'm going to go through how, and oftentimes it's a response to the treatment that tells us. And the one thing is that horses can easily die of colic or can have surgery if that's possible. But most of the time, those things is that they just don't respond to medication. We have a lot of medication available to us that helps with the abdominal pain. And most of the times things are pretty simple. So a good physical exam is just like a good physical exam on a dog or a cat or a cow, starting from the front end and going back. Usually it's temperature, pulse, and respiration. You would start with mucous membranes. checking whether they're pink, whether they're moist, what the capillary refill time is. Do they look blue or very purple? That's not a good sign in a horse. That means they're in shock. You would listen to the heart and establish what the normal heart rate is, about 40 in a horse. If it's rapid, if it's slow, you would listen to the lungs, but also most importantly, listen to 4 quadrants in the back and the flank, upper and lower quadrant on the left and upper and lower quadrant on the right. And you would be listening for sounds. Most of the time with colic, there'll be a lack of sounds or a decrease. Sometimes when you have diarrhea, there'll be an increase in sound. But those are a good physical exam, no matter what species, is important. And even if you're someone that doesn't do horse work and you're faced with looking at a horse that doesn't look right, a good physical exam. Again, part of our colic examination would always do a rectal examination where you would feel whether you had dilated small intestine, large intestine, whether your colon was full of feces and would have an impaction. So you just go, those would be the things that you would do. Again, ultrasound is used a lot in horses. This picture here is an ultrasound machine on the left side of a horse, and on the right side in the picture is very dilated small intestine, and that would not be a good sign. That really indicates that you probably have something that's obstruction causing that dilation. So I know and I guess afterwards, I really want to find out what medications you have available to you. I'm going to go through ones that we use. I don't know if you have them available. I did try to look. I think you do. I mean, I'm always amazed when I go to different developing countries that you have much more drugs available to you than we do, just readily available to everybody. But anyways, if I had a horse with colic and that it was uncomfortable, after doing a physical exam, I would probably give him some analgesic, an analgesic like flunixin, meglumine. We call it Banamine. And the doses it varies, but my typical dose would be for a 1,000-pound horse would be 10 cc's, which is the 1.1 meg per kg. We give that IV. If you look on the bottle, it says you can give it IM, but I would never give it IM because we have found that there is a high incidence of clostridial infections from an intramuscular injection. And the muscles can slough and it's very nasty. So it is only to be given IV. Or you can actually give the oral product orally. There is also paste available, but you can use the injectable orally and it works very well. At the very low dose, you can have it can have what we call anti-endotoxic dose. So if you had certain bacteria that were bad bacteria that were proliferating, that can help with that. But basically with the routine colic, you're going to give them Banamine to get them out of pain. And it is very good. It lasts for up to 6 hours, can even last longer. And sometimes it can be too good and that you think your horse is fine and really it isn't. Oftentimes, it does take a little time for the Banamine to take effect. If a horse is really uncomfortable, if I'm called to the barn and it's very uncomfortable, it's throwing himself on the ground, and I can get a brief exam done, but I may even not even be able to do a rectal exam because the horse is throwing itself on the ground. Cows are stoic, horses are not. I will give it Ditomidine, which is a great sedative, and it can be given IV and IM, and it can be given at a very low dose. I oftentimes start as low as 0.01 meg per kg. But it really takes the pain away right away. It's a great sedation and analgesic. So it's probably my go-to. And if I have a colic, a significant colic. Next one is xylazine, which is good too. I just don't feel as if it lasts quite as long, but it is very good and it is analgesic. But you have to realize that all your sedatives can slow the GI tract a little bit as well. If we have a horse that's in significant amount of pain, we may add butorphanol to the sedative, and that is given at a pretty low dose, as low as 0.005 megs per kg. But it does help, and it helps lengthen the time that the analgesic effect from the sedative. But if you give it in a high dose that's on the bottle, the horse, and you give it by itself, the horse will head press, and it's kind of ugly. So I definitely use butorphanol in conjunction with other medication. There are antispasmodics, and when I was talking to Dr. Benjamin, he talked about the use of that atropine used to be used as an antispasmodic. We would never use atropine at this point in time as an antispasmodic. We have a medication called Buscopan, which works very well as far as an antispasmodic, which decreases the smooth muscle contracture. But atropine actually decreases, may slow the smooth muscle contraction, but it also decreases motility such that it can cause colic. Even atropine administered to a horse's eye in excess can cause and slow the GI tract. I listed up a lot of other analgesics that are available, and I know diclofenac is something that you have, and we don't have it. We only use it topically, but I would wonder, and someone can give me feedback in India whether you use that injectable. Phenylbutazone, a product, ketoprofen, meloxicam. We don't use those typically in colic. Acepromazine is another tranquilizer, but it doesn't have any analgesic effect, and it usually lowers the blood pressure. Romifidine, we don't have available to us. So I think if people have questions about medication, you can ask me more on the question and answer, but that's kind of my highlight for that. Treatment is every horse, and it's also actually somewhat used as a diagnosis as well. Would be to pass a nasogastric tube. And the picture on the upper left is me with COVID style with a mask on, but that's kind of hard to do that, I have to say. But anyways, there are several laxatives that we administer via nasogastric, and you have to have a special tube. It has to be the right diameter to go up the ventral meatus of a horse's nostril. And it's not an orogastric. On the lower right, there's a picture of a cow. You don't use a speculum in a horse. So you have to be, and there's a finesse to doing that, and expertise with doing horses. Just like in cows, you can put it in the wrong spot. And in horses, you have to really be careful and make sure you know what you're doing, putting it down. I oftentimes feel the tube going down. I watch the tube going. The esophagus usually sits on the left-hand side of the neck. So I do that. I check many different ways. That's not a mistake because you'll have a dead horse on your hand. So what are the laxatives that we use? Mineral oil softens the feces. It is a gallon of mineral oil is oftentimes a half gallon to a gallon to a 1,000-pound horse. You can use what we call Epsom salts of magnesium sulfate, and a pound to a gallon of water works very well. You can use psyllium. We use that more, say, in like if you had sand colic, and because it's basically, it's a bulk and it just helps move things through. DSS was used a long time ago. I can remember as a child, my father is a veterinarian. I can remember using it. And it is very irritating to the mucosa, so it's not used as it used to be. And then the other thing is just intravenous or enteral fluids. In other words, just giving water via stomach tube. That can help. So I wanted to kind of give an overview of, so, okay, we've been talking about how to treat it, and oftentimes we don't know what causes it. We treat it before we know exactly what causes it, but I think it's important to know what causes the gut to hurt. And this is kind of an overview of different things that could cause problems, that could cause a horse to show abdominal pain. And again, the signs can be very different. They can be very mild, or they can be such that they're throwing themselves on the ground and you can't keep them up. It could be just intestinal dysfunction, like distension with gas, fluid, impactions, a spasmodic gas colic. It could be what we call an intestinal accident, meaning that the intestine goes where it shouldn't. And again, that goes into that poorly designed system. It could be that something ties off and a piece of small intestine dies. It could be that there's gastric ulcers that causes the horse to feel, or a foal to feel poorly. Or it could be an ulcer in the colon that causes pain. It could be inflammation. It could be diarrhea. It could be a fever. It could be an enteritis in the small intestine. So there's a lot of things that can cause. And one thing I didn't mention is with the enteritis is that's why when you pass a stomach tube, you check and make sure you don't have reflux off of it, because sometimes if you have a reflux, you already know that there's an obstruction. I'll go over that a little bit further down, but I want to go in a little bit more. And here's a picture of a foal which ruptured its intestine from ascarids or roundworm impaction. So intestinal dysfunction can be just a little gas, no big deal, maybe ate something that didn't agree with them, just like us. It could be, and that could cause some smooth muscle contraction, causing a spasmodic gas colic. Or you could have a horse that's been working. And one thing, and I'm just always amazed how little water a lot of the animals in India drink. We are very conscious of making sure our animals drink water all the time. And oftentimes, if they don't drink well, then they become constipated, basically, and we develop an impaction. Or they don't chew the food well, or they're eating their hay or food on the ground and they take in sand and gravel, or the ascarids. Again, causes lack of water, stress, lack of deworming or parasite resistance, dietary changes, unclean food. And treatment typically for these, it's usually Banamine and some laxative, and usually they get better. So these don't cause a big deal of problem, but they can make the horses pretty uncomfortable. And they usually respond to medical treatment. And sometimes they don't need medical treatment. They just need to be walked. But oftentimes we can get to a point where there's what we call an intestinal accident. In other words, things are where they shouldn't be. And on a rectal examination, you may feel that you go in the rectum and you feel, oh, gas. And the large colon is very distended with gas. And that means that there's things aren't going with the way they should, and there's a backup of gas. It can be that your left colon can just go where it shouldn't, or your right colon could go where it shouldn't. Oftentimes in those situations, you can just take some feet away, you can exercise, but sometimes they do require surgery. I'm going to have a picture on the next page of what they call a nephrosplenic entrapment, which is basically the colon gets stuck between the spleen and the left kidney. And sometimes you can give medication called phenylephrine that will cause contracture of that, and that will get better. But you have to be very careful, because in older horses, sometimes that can cause rupture of the colon. You can have strangulated intestine where there's a lack of blood supply. That can be in the large intestine. It can be in the large colon, can actually twist on itself. They're extremely painful with that. You can have small intestine that can be like, say, horses, older horses in our population of horses in the United States is living so much longer. They develop lipomas that tie off certain parts of their intestine. And those would require, in those, surgical resection into poor prognosis. And oftentimes time is very important. You can have like what we call intralis or benzors, where you have like they ate a piece of wire. And then over time, you've just got mineral buildup. So that kind of forms layers around these. And then these interluminal masses actually obstruct in the GI tract. So this is, I do not do surgery. I am a large animal. I do everything in the field. I do not do surgery. We would refer, we're blessed by 3 referral hospitals right close to us. But horses are very complicated, and they have a very large colon with lots of loops to it. And this is a picture of a horse on its back having surgery. And this is a picture on the upper right hand side. Is to the left, you'll see the stomach. Then you'll see basically large colon, and you'll see the spleen. And then you'll see another loop of colon underneath. And what's happened is this loop of large colon has looped up and kind of got itself nestled between the spleen and the kidney. And that's what we call a left dorsal displacement, or a nephrosplenic entrapment. So, and this is strangulated intestine. It's just like if you do dogs and cats, just what it looks, the intestine ties itself off and it doesn't get the blood supply and it becomes black and it needs to be taken away, or the animal will die of due to the toxin buildup or rupture. And these on the left is a picture of a horse that has some small intestinal obstruction of some sort. So you get these big, huge dilated loops of small intestine. You've got to realize the jejunum of a horse is probably 70 feet long. And these will all fill up. And normally you'll see those moving all over the place, very modal in a normal horse. And when one has an obstructive lesion, you have these dilated loops of intestine. So I better slow myself up. Maybe I'm speaking too quick, but Another cause of GI pain are gastric ulcers. In the United States, we probably don't feed our horses the way they should and feed too much concentrates, too much grain, not enough forage. And oftentimes that can be a problem. And they're not left outside, they're in stalls more than probably your horses in India. But it's usually associated with horses that are stalled, that are exercised heavily. They have more grain than they have and decreased forage, and they don't eat all the time. And the severity of ulcers are not always based on the severity of signs. So in other words, you can have very mild signs and have severe ulcers. So this is a picture of a foal that had some, the stomach has a non-glandular or squamous portion and glandular portion. And you can have ulcers in both sides. This has it in the non-glandular section of the small intestine. And this foal was young. It was given to me by one of my associates, and she worked in a referral hospital, and this foal just wasn't doing well, not gaining weight well, just mildly colicky. So the biggest thing is that management is that they need to be fed all the time. They need to be out grazing all the time or as much as possible. Small meals frequently, big versus big, having kind of a low starch, low sugar diets. Alfalfa hay is a great, acts as a great buffer because it's higher in protein and calcium, and it kind of buffers, because you've got to remember, in a horse, in the stomach, food leaves there quite quickly, and there's hydrochloric acid produced in the stomach. And that is, if it doesn't have food in it, it just splashes there and causes irritation of the stomach wall. So that's why the ulcers, like when the stomach is empty. So you want things, feed things that kind of buffer those things, and basically feeding a high fiber diet and also things that are higher in protein and calcium help. In the States, we have omeprazole, which is under the name GastroGuard, is used, which is basically it inhibits the protein pump or slows the protein pump that helps produce hydrochloric acid, but allows enough hydrochloric acid to be produced to digest food. Sucralfate is also, and that's a product that's used in small animal medicine, which kind of coats the stomach. Ranitidine and cimetidine are basically antihistamines, and they don't work that well. They were used before we had the omeprazole. Then there are more things that can cause GI pain. Inflammation. Inflammation probably is mostly, we see it as like, say, diarrhea. You may have a horse that has colicky signs though, and just has a fever and without diarrhea. But oftentimes it's because certain bacteria, there's overgrowth of some of the bacteria that are not so good for the intestinal tract. Sometimes it's being exposed to a bacteria that's can cause a lot of problems like salmonella and clostridial. Coronavirus is one thing we've had issues with here in the States. You can have inflammatory bowel disease in horses. Parasites can be a problem. Encysted small strongyles can be a problem. Can be toxins and weeds. Can be neoplasia. Could be lymphoma. Could be dietary intolerance. But most of the time, the diarrhea is caused by issues in the large intestine, causing a severe colitis. These horses are really sick. Their mucous membranes are purple. They have heart rates over 100, and they're shocky. All their perimeters are ears are cold, their legs are cold. They want to die. And unless you do a lot of intensive care with these, they don't usually make it. You can have small intestinal disease called enteritis. And again, this is when you would pass a stomach tube and you get like a bucket full of fluid back up off the intestine, off the stomach. Also right dorsal colitis is another thing that we have found in the States that can cause colic. And they feel as if it's associated with too many non-steroidal anti-inflammatories like Banamine, like phenylbutazone, for pain. So I guess, there are other things to consider that are not GI. So what do we have inside the abdomen? We have the liver. You can have bile stones. Remember, horses don't have gallbladders, but they have biliary stones. They have bile, and they can get stones in these tracts. And you can have kidney stones. You can have bladder infections. You can have peritonitis, which is just an infection in the abdomen around the intestine. You can have cancer. All these things can cause abdominal pain from the abdomen, but not necessarily be GI related. This is again from one of my associates. This was a 12-year-old quarter horse mare, and she presented to the veterinary hospital, and she had had chronic mild colic for about 6 weeks. She had some weight loss, and she had this dermatitis on her nose, and her liver values were elevated, particularly her GGT and ALK Phos. And then on ultrasound, this is the liver, this is the duodenum, and there are spots that are on, there are spots here that are, that had the appearance that they were concerned that there was some problem with the biliary tract. So they took her to surgery, and they found a golf ball-sized stone in the common bile duct, and they were able to milk it into the duodenum. And she went back, she was a barrel racer, and she went back to barrel racing. But sometimes you can have big stones, gallstones, seen here and here. And needless to say, they don't make it, and they end up in postmortem. So there are other things that can cause pain in the abdomen. Another picture of it opened up. And these are, and again, I have to say, Dr. Benjamin mentioned this to me, and there are other things to consider. It could be that it's not in the abdomen at all. Maybe this horse has an infection on its leg, and it's so uncomfortable that it's acting, kind of kicking its leg and acting like it's got abdominal pain, but it's not actually coming from the abdomen. This is from me when in Kashmir, on the upper left-hand corner, upper right, above, this is a foal that was walking along the road with Gujars that was walking on his coffin joint that was opened. He was in quite a bit of pain, but it was not so much, I was just amazed because foal was just dull. It wasn't that it was like non-weight bearing. It was actually walking on this leg, but it was dull and just feeling miserable. And then this other one was a horse that was had a wound on it in a Gujar village. But this one in the lower right is something to consider, which something I wouldn't consider because we routinely vaccinate for tetanus. But tetanus in horses is a reality. They may act like similar, like that, stretching out like they have to urinate. Their ears may be kind of in a weird position. Their tail might be sticking out back, acting like they are colic, but it's not, it's tetanus. Because I know in the States, we routinely vaccinate, but you wouldn't. The one other sign is when you lift up the nose on a horse, if it was tetanus, the third eyelid would flash. But it's something to consider, especially in a cart horse out in an area. So I'm going to ask a bunch of questions, and I know I want to get information from you. Is how often does colic actually appear in India? Do you ever see it? And how serious are they usually? And is death common? And how do you treat it in India? The picture down here is I see horses being used as cart horses. I know Dr. Dixon said up in Delhi, you'd see him in front of the Taj Mahal, or, maybe cart horses are used someone to do the work that cattle would do, but not usually because it's expensive. But in the Himalayas, these are Gujars that are traveling from up into the mountains during the summer months for pasture for their horses. So horses are used as pack animals to get them there. I see, from my perspective, and from my little stint in India, is that in horses would be a lack of water would be a risk factor for horses in India. Parasites, and in that is probably whether you have parasite resistance with all your dewormers, whether they're actually being dewormed, eating poor quality forage and food, like eating food where there is just stuff on the ground that it's from trash. Animal care. If they can't chew properly, they can't swallow. It's not presented to the stomach properly. It's not, and so it's not, because chewing is part of the digestive process. So they need to chew properly, and they need to have good dentition in order to do that. And I'm just asking for you to tell me. But as far as my take-home message, sometimes we talk about colic and it seems like most of the horses die or they need surgery. But I mean, we have a pretty good size large animal practice. I probably treat 2 colics a week, and I may only have 1, and then we have 4 veterinarians working for us, and we may send 1 colic to surgery every 2 to 3 months. Most horses recover without surgical intervention. Some need treatment. Some of them get over it spontaneously. People will get a call and will say, walk them until I get there. And oftentimes they'll get over it just by walking and moving. But sometimes some die. That's a reality. It's better to prevent as much as possible to minimize the risk. Good management practices help minimize the risk. Routine dental care, gradual feed changes. Horses are not cows. They do need a lot of training. We definitely recommend that horses have dentals or floating once or twice a year. You need to limit the amount of concentrates that are fed. They need to be fed high fiber diets. And we're routine deworming, or we don't routinely deworm because we have issues with resistance, but we do parasite control. In other words, we do a lot of our deworming based on fecal egg counts. So in other words, we don't just deworm every 2 months or just because it's that time of year. We oftentimes do fecal egg counts and deworm based on that because of the resistance problem. So we're strategic in our deworming. But based on like a young horse, we would definitely be more attentive to ascarids but horses tend to be develop resistance to ascarids after 2 years of age. It's still a risk, but you're just strategic about what you do. So abdominal pain, mostly GI in origin. We've gone over all that. Impactions, inflammation, spasmodic colic, and it usually responds to medical treatment. But surgical intervention and hospitalization, even euthanasia, is required in severe cases. Sometimes some horses just are in so much pain, they can't stand it. Keep an open mind. It may not be coming from the abdomen. It may be pneumonia, maybe a leg injury. It could be tetanus. So that's all I have. So I open it up to questions. This is my family, not the horses, but everyone else.